Hi, I am Dr. Nikita Gunade and I'm going to talk about epilepsy history and counseling for NAC OSCE. This video is for education purposes only. The outline of this will be introduction, how to analyze epilepsy history, what are the triggering factors, counseling to the patient, and plan of management. In introduction, it is always better to start by introducing yourself, asking the patient how they would like to address themselves. Ask an open-ended question. Example, how can I help you today? For analyzing epilepsy history, ask the following questions. When was the diagnosis made? Or what was the age of onset? How frequently does the patient get attack? Does the patient follow up regularly with doctor? If yes, ask about the last visit. If no, make the patient comfortable by saying, glad you made it today and I'm happy to help you. When was the last episode? How long does the attack last? And was there any loss of consciousness? Ask about aura, flashes of light prior to the attack. Ask about what happens during the attack, or ask, did anyone tell you or saw you? Ask about, does the patient shakes? Is there any tongue biting, eyes rolling up, or does the patient wet his or her pants? Ask about, how does the patient feel after the attack? Coming to the medications, ask about if he is taking any anti-epileptic drugs. Does the patient is experiencing any side effects? And if the patient is compliant with the drugs. It's better to ask about if any new medication was added recently, as certain medication can interfere with anti-epileptic drugs. It's always better to rule out other causes before making the diagnosis of epilepsy. Ask about other symptoms like headache, any tingling or numbness, blurry vision, difficulty speaking, and loss of balance. Any fever, night sweats, weight changes, or loss of appetite. These are the constitutional symptoms. Coming to the triggering factors, make patient comfortable and make sure that whatever we are discussing is completely confidential. Ask about if the patient is drinking alcohol, if the patient smokes, or if the patient has tried any recreational drugs like cocaine or amphetamine, as these are the triggering factors for epilepsy. Ask about the patient's sleeping habit, if the patient has difficulty sleeping or has long screen hours before sleeping. It's better to always ask about the patient's mood. Coming to the activities, ask the patient what kind of activities the patient enjoys. For example, swimming, heavy metal tools, or hiking, as these are certain dangerous activities. At the end, it's better to ask with whom does the patient live. For counseling, it is always better to ask the patient what is their understanding about seizures and would they like you to explain more about seizures. If yes, you can go about by saying that it is a common condition due to increased electrical activity in the brain which causes abnormal body movements. It's always better to explain in simple language so that it is easy for the patient to understand. Tell the patient that for the diagnosis of epilepsy, it requires occurrence of 2 unprovoked episodes 24 hours apart. And most of the patients have no clear cause. But there can be other structural causes which should be ruled out. For example, syncope, vascular causes, metabolic causes, and psychiatric causes like conversion disorder, panic attack, and malingering. For the plan, it consists of diagnostic workup, patient education, and treatment. For diagnostic workup, tell the patient that the imaging should be done. 2 can be done like MRI or CT scan and EEG. Lumbar puncture for CSF analysis has a role if patient is obtunded or in whom meningitis or encephalitis is suspected. It is better to do the serum levels for anti-epileptic drugs to see the therapeutic levels. Coming to patient's education, tell the patient to avoid dangerous activities to prevent injury. Coming to driving, tell the patient that it is your legal obligation to report to Ministry of Transportation and he must be seizure free for at least a year before starting the driving. It's always better to tell the patient to avoid diving or hiking and to take certain precautions if the patient is going for swimming. Tell the patient to avoid the precipitating factors for epilepsy like alcohol, stress, sleep deprivation, forgetting to take medications, or taking other medications that interact with the treatment. Coming to lifestyle modification, explain the patient about taking the treatment properly and tell them for how long the patient will have to take. Make sure you make them aware that it can be for whole life. Explain them to talk to the physician about any new medications if the patients want to take. Coming to female patients, if they are planning to get pregnant, tell them that these anti-epileptic drugs can be teratogenic and tell them to take proper contraceptive measure. If the seizure occurs, tell them to go to the ER. Regular follow-up and monitoring of anticonvulsant level in blood should be done. For the treatment plan, it consists of anticonvulsant drug, avoidance of typical precipitants, tell about the medication side effects, and explain about discontinuation of anticonvulsant drug. At the end, make sure what can be the discontinuation plan. After the patient is seizure free for 2 to 5 years, physician can consider discontinuing the medication. But make sure to tell the patient that 75% of relapses after discontinuation in the first year and 50% of patients who have another seizure do so in the first 3 months. Therefore, it is recommended for the patient to observe strict seizure precautions, which includes not driving, during the tapering and after discontinuation for at least 3 months. In the end, it's better to ask the patient, do you have any questions for me? And we can start working on this together starting today. Thank you.